Gonioscopy, Wikipedia audio. Gonioscopy describes the use of a goniolens in conjunction with a slit lamp or operating microscope to gain a view of the iridocorneal angle, or the anatomical angle formed between the eye's cornea and iris. The importance of this process is in diagnosing and monitoring various eye conditions associated with glaucoma. The goniolens allows the clinician, usually an ophthalmologist or optometrist, to view the iridocorneal angle through a mirror or prism, without which the angle is masked by total internal reflection from the ocular tissue. The mechanism for this process varies with each type of goniolens. 3 examples of goniolenses are the goniolens or gonioscope. There are many other goniolenses available for use, including modified versions the aforementioned, which proved valuable for surgical use. Although the details vary based on the type of goniolens used, in general the gonioscopy process involves Cope direct goniolens. This transparent device is placed directly on the cornea along with lubricating fluid, to avoid damaging its surface. The steeper curvature of this goniolens exterior surface optically eliminates the total internal reflection problem and allows a view of the iridocorneal angle. Unfortunately, it requires the patient to be lying down, and so it cannot be so easily used with an ordinary slit lamp in an optometric environment. In an ophthalmological setting, an operating microscope is one available option. Goldman indirect goniolens. This truncated cone-like device utilizes mirrors to reflect the light from the iridocorneal angle into the direction of the observer. In practice, the image comes out roughly orthogonal to the back surface, making observation and magnification with a slit lamp easy and reliable. The small, curved front surface does not rest on the cornea, but instead vaults over it, with lubricating fluid filling the gap. The border of the front surface rests on the sclera. While the view obtained is smaller than that of the Cope goniolens, it can be used with the patient sitting upright, and other mirrors within the device can be used to obtain views of other parts of the eye, such as the retina and the ora serrata. Zeiss indirect goniolens. This instrument uses a similar method to the Goldman, but employs prisms in the place of mirrors. Its 4 symmetrical prisms allow visualization of the iridocorneal angle in 4 quadrants of the eye simultaneously, and works well with a slit lamp. Most importantly, the size and shape of the instrument, a smaller front surface that rests on the cornea without requiring lubricating fluid, only the patient's tear film, allows for indentation gonioscopy, which can be used for further diagnosis. The typical view through most goniolenses is illustrated by these idealistic schematic diagrams. In reality, the clinical picture can vary both within and between individual patients. This view of the iridocorneal angle provides information in several ways. Briefly explaining the procedure to the patient: cleaning and sterilizing the front surface of the goniolens, applying lubricating fluid to the front surface if appropriate, anesthetizing the patient's cornea with topical anesthetic, preparing the slit lamp for viewing through the goniolens, gently moving the patient's eyelids away from the cornea, slowly applying the goniolens to the ocular surface, forming suction, fine-tuning the slit lamp to optimize the view, interpreting the gonioscopic image. Swiveling the goniolens to view each section of the iridocorneal angle. When satisfied, very carefully breaking suction via the eyelids, cleaning the instruments and irrigating the patient's eyes with if desired. The gonioscopy process. Interpreting the gonioscopic image.